Dr. Shivashankar Punapareddy Garu. A heartful welcome, sir. We are glad to have you. So today is also marked as World Hepatitis Day. So before we start the event, I would like to call upon all the dignitaries onto the dais. I would like to call upon Dr. Gopal Krishna Garu, President HMAT onto the dais. Sponsor of today's event, Dr. G.R. Mohan Garu onto the dais. Our chief speaker, Dr. Shivashankar Sir onto the dais. Our General Secretary, Dr. G. Durga Prasad Rao Garu. And our panel speakers, Dr. Venugopal Gauri Garu. Every occasion is enlightened by taking the name of God. So now I call upon Dr. Harshita Bore ma'am to come on to the dais for the prayer song. Thank you, ma'am, for a melodious beginning. Now, I request all the dignitaries and all the VIPs to please contribute, pay the tributes to Dr. G. Ramchander Rao Garu. I request all the dignitaries to please join the tributes. Thank you, everyone. Now, I request our President, Dr. Gopala Krishna Garu, to present the welcome address. Please welcome, sir, with a round of applause.
Good evening, ladies and gentlemen. respected distinguished speaker of this evening, our teacher, Dr. Shivashankar Garu, and sponsor of today's event, our teacher, Dr. G.R. Mohan Garu, our General Secretary, Dr. Durga Prasad Rao, Dr. Venugopal Gauri, Dr. Manik Prabhu, and all the executive members of our association, and all the distinguished invitees, friends, practitioners. A hearty welcome to you all on behalf of the ITMAT for Sri Dr. Ramchander Rao Memorial Oration. Dr. Ramchander Rao Garu was a veteran physician and he was superintendent of People Hospital, and he was a great physician, administrator, teacher, and he served in many capacities in the Department of Health and Medical Education. So we heartily pay our homage to him on this occasion, and we thank all the people who have come to this oration and encouraging us. And the online session, all the audience, we thank you all for showing interest to hear this oration. Thank you all.
Thank you, sir, for acknowledging everyone about the oration. Now, I request our General Secretary, Dr. Durga Prasad Rao Garu, to please come on to the dais and say about the memorial oration and introduction about Dr. G. Ramchander Rao Garu.
Respected President Dr. Gopal Vishnu sir, your today's sponsor, Professor Dr. G.R. Mohan sir, and the former External Director and advisor of the ITMAT, today's principal speaker, Dr. Shivashankar Punapareddy sir, and my governing council members and all the doctors. First, on behalf of ITMAT, let me pay the homage to the late Dr. G. Ramchander Rao Garu, on whose memory today we are conducting the memorial oration. Every time we conduct memorial oration monthly once on somebody's name, and every year in the month of July we conduct a memorial oration in the name of the great soul Dr. G. Ramchander Rao Garu. And about the HMAT, you know, we do many activities like medical services, Dr. C.L. Modi Charitable Dispensary and specialty clinics, which with senior and expert honorary consultants from cities. We have been conducting it for several years. And the outpatient department runs throughout the year, all days, including Sundays. And apart from these medical services, we conduct this monthly orations like this every month. And also, we conduct medical camps and sometimes periodically the national level and state level seminars also. And in addition to this, we train the internees, house physicians who are posted by the homeopathic medical colleges of the Telangana, and we train them to hone their skills for to develop their clinical acumen and before they start to practice. And today I am proud to announce that we are able to conduct a good topic on the beyond the conventional homeopathic prescribing by the giant homeopath and the doctor more than 60 years experience, the wizard of homeopathy, our master Dr. Shivashankar sir, and we are going to hear many advices and suggestions. Thank you for giving me this opportunity. Thank you, sir.
Thank you, sir. Now I call upon Dr. Gautam Radhavandi sir to introduce the chief speaker of the oration.
Good evening, everyone. It's a great pleasure for me to introduce the Master of Masters, Dr. Shivashankar Punapareddy Garu. Dr. Shivashankar Punapareddy Garu, born
4th of July in the year 1940 in Vijayawada to Sri Nagabhushan Rao Garu and Srimati Krishnaveni Garu. He did his schooling from Mangalore High School, later intermediate in Guntur. Sir did his homeopathy graduation in Gudivada, passed out in the year 1962, which is considered to be the first recognized batch in South India. Homeopathy was recognized in the year 1958. So 4 years after that, the batch was recognized. He completed in 1962 his BHMS. Later in 1963, he joined his father's practice. In the same year, he got a call from Gudivada for the post of junior lecturer, where he gave his services for 4 years. Then later came to Hyderabad in the year 1967 in the month of December, just 2 months before Jayasurya Medical College was established, when Dr. Nagabhushan sir was the principal of that college, where Dr. M.K.S. Kudumbarao sir was his contemporary lecturer. Later government took over the college in the year 1972. Sir was taken as professor. In 1980, he was posted as hospital superintendent. Later in the year 1982, he was promoted as principal. First batch of MBAs graduated course was admitted then. In the year 1984, as Dr. Nagabhushanam sir passed away, as he was the additional director then for homeopathy, Dr. Shivashankar Punapreti sir was posted as additional director of homeo, and he gave his services for 6 years. Then, in the year 1988, he discontinued his services due to loss of his son. Director N.V.S. Shastri sir advised him to apply for voluntary retirement, and hence he was awarded the same. And when he came out of his service at the age of 48 years, Dr. Shivashankar Punapreti sir is also an honorary advisor for our association, Homeopathic Medical Association of Telangana, with experience of over 6 decades of homeopathic practice. Sir has trained more than 250 homeopathic graduates who are practicing around the globe. So it's a great honor for us and great pleasure for us to hear from you, sir. Thank you.
Thank you, sir. So now the panelists for today's oration will be Dr. Gopal Krishna Garu, Dr. Venugopal Gauri Garu, Dr. Vivek Areti Garu, Dr. Venkat Raghav Garu, and Dr. Harshita Ude Garu. So before starting the oration, we like to introduce the panel members of today's session. Dr. K. Gopal Krishna Garu is a senior homeopath, and he is the first batch of graduate from combined state of Andhra and Telangana. He had a major role in converting homeopathic diploma to degree course in the combined state of Andhra Pradesh and Telangana. He is practicing since 44 years, and he is the torch bearer of HMAT, and he is connected to HMAT for more than 3 decades. And he is also the medical director of CL Modi Charitable Trust. Then we have our next panelist, Dr. Venugopal Gauri Garu. Dr. Venugopal Gauri Garu has completed his BHMS and MD, and is practicing homeopathy from 1994. And he has also published an international research article on carcinosin reversing changes in pancreatic inflammation, which was published in the World Journal of Homeopathic Research. He has more than 500 articles to his credit in the national newspaper, The Hindu. Vivek Areti Garu. Dr. Vivek Areti Garu completed his MBBS from Kamneni, and he also completed his MF in homeopathy from London. And he is practicing in Kukatpally and Secunderabad for more than 6 years. And he is carrying the legacy of his grandfather, none other than our chief speaker, Dr. Shivashankar Punapreti Garu. Our next panelist is Dr. Venkat Raghav Garu. Dr. G. Venkat Raghav Garu completed his BHMS from Dev's Homeopathic Medical College, Hyderabad in the year 2020. And he has worked under Shivashankar sir's guidance in his clinic for 2.5 years as an assistant doctor. He started Sri Raghavendra Homeo Clinic in Banasta in 2023. Now, our last panelist is Dr. Harshita Ude Garu. She has completed her BHMS from Dev's Homeopathic Medical College and Hospital in the year 2022. And from then, she has been practicing as a morning consultant at Dr. C.L. Modi Charitable Dispensary for around 2.5 years. And she has her own clinic, Dr. Das Homeopathic Clinic, and she's practicing there for around 1.5 years. Now, I call upon Dr. G. Durga Prasad Rao Garu, our General Secretary, to please come and introduce about the oration.
Thank you. Before we start the oration, it is my privilege to introduce about the Dr. G. Ramchander Rao Garu, on whose name today we are gathered here to conduct the oration. Dr. G. Ramchander Rao Garu, a renowned physician who excelled as a teacher of medicine and also a ardent practitioner. Dr. Ramchander Rao hails from an educational family, as his father was a district educational officer. First, he was posted as a medical officer at TP Sanatorium, Anantagiri. Then he became the RMO of the government civil hospital, Karimnagar. Afterwards, he had gone to Gandhi Medical College as assistant professor. Then he became the professor of medicine at Rangaraya Medical College, Kakinada. And he worked as a professor of medicine at Kakatiya Medical College, Warangal. Lastly, retired as professor of communicable diseases from Gandhi and Usmania Medical Colleges. And he was also the superintendent of government civil hospital. And he was also appointed as a WHO consultant for a short time. This year, today, his oration is being addressed by our senior Dr. Shivashankar sir and panel speakers, Dr. Gopal Krishna, Dr. Vedgopal Gauri, Dr. Sai Vivek, Dr. Venkat Raghav, and Dr. Harshita Ugure. And before going to start the oration, just let me know, first let me introduce about the oration and the beyond the conventional homeopathic prescribing is a wide topic. Even several years, decades after the generations together also, today also there is a acronym the prescription and many even senior homeopaths also sometimes fail to give proper prescription, not because of their lack of knowledge, but not because of their seniority or experience, but there is the homeopathic prescription is a art and a science also. The life is short and art long. The crisis fleeting, experience perilous. Decision difficult. The physician not only what is right himself, but also to make the patient, the attendant, and the external cooperate. This is the first of all of the Hippocrates. So today we are going to hear from the speaker Shivashankar sir and the conversation with the panel speakers. And starting from the Hahnemann's time to the present day also, the intellectual origin of academic scholasticism and all veterans, erudite scholars and stalwarts have been emphasizing an evolution of unfailing guide for selection of the remedy. To study the drug and disease symptoms of the media for every scientific system of medicine. So now today let us hear what the symptoms say, what the drugs say, what the disease implies, and how the prescription goes in homeopathy, and what are the types of prescription. Let us hear very shortly. Thank you. Now, I request our president, the main panel speaker, Dr. Gopal Krishna sir, to just start a conversation with Dr. Shivashankar sir. Sir, sir.
We are really fortunate to hear Dr. Shivashankar sir. Very vast experience as a physician, as a teacher, as an administrator. And he also wrote a few books and he edited our journal for more than 100 issues. So such a vast knowledge, it is very rarely found. So we are of utmost good fortune to hear him answer our queries. So whatever little we can learn from his knowledge, his experience and knowledge, so it would be immensely benefiting all of us. So before that, the status of homeopathy in our country, I would like to say few lines. So in the year 1973, Government of India recognized homeopathy as one of the national systems of medicine. So now around 2 lakh practitioners are there in our country. So every year around 12,000 practitioners are added. Around 220 to 247 colleges are there in our country. So out of 1.3 billion population in our country, so around 1 crore, 10 crore people depend on homeopathy directly, indirectly, or solely. So we have to see that the number of people seeking homeopathic therapy should get enhanced. So our practicing doctors, the graduates who are coming out from the colleges are not totally taking up the profession. So keeping that in view and the need of our efficient and able practice towards people, so we are trying to organize such events. So the homeopathy, usefulness of homeopathy, utility or utilization of homeopathy in our country, the administration, how are the state or the governments, how they are making use of the available homeopathic doctors in our country. So all those things we have to keep in our mind. So it is really urgent need of all the graduates who are turned out of the college to take up practice and serve the sick, because homeopathy has so many advantages over other therapeutic sciences. So let us see that it reaches the needy people. So today, 28th July is National Parents Day also. World Day for Grandparents and Elderly. And this month, Sir birthday was on 4th July. So such a auspicious time it is. So we wish we would be immensely benefited by hearing Dr. Shivashankar Garu. Thank you.
Thank you, sir. Thank you for your fine meeting. And now I request Dr. Vedgopal Gauri to start the conversation.
It is a very great movement for all of us. We've been interacting with all of our homeopathic friends, and this is also especially big because we want to have all your thoughts about our system of medicine. And we consider a great platform and opportunity to grow your mind. We are aware, but we also want to understand the practice that is coming
understand what they are going to pay to the current income and whatever their next to take it along. And I don't find that we need to most of the factory and our nearby consideration to some extent and also. We have made calls to one and 250 practitioners to understand if they have any questions to share and ask and we have made a list of all these and in that is like it's just around there. And on my way of emeritus president of the DRC, we have included in this panel basically around the experience. Somebody who just somebody who practice like somebody who knows experience and share, and someone like who is fine to the rural area and practice where people are scared of practicing together. And he has some questions. And we have our language of the day will be for the 6 years. And we make on the day, there are some challenges and we would like to know from sir. And we practice for 3 years and I'm still like and I deserve the 45 years of experience, but still our energies and our experience because there's something coming up all the time. And for example, we passed through a pandemic and it was one of the best moments of career. And I know how to take these times. And we want you to enlighten us more. And give us the better direction as far as our country is concerned in the days to come, as far as the whole strategy. Thank you, sir. And this was Dr. Ramchander to start still not PBI and reported in the appearance. There are asking one question where we are going to answer.
So first question is I would like to ask you, how did you choose to study homeopathy? How did you choose to study homeopathy?
I did not choose to study homeopathy. I was protesting to study homeopathy, as a matter of fact. My father was a homeopath, so he forced me to join a homeopathy college, and I joined a homeopathy college. Good evening, ladies and gentlemen. Let me start the proceedings with my pranamams to late Dr. G.R. Rao, a great physician, a great academician, with whom I had a good opportunity of acquaintance for a long period, one of the greatest physicians and a great human being. So every year we meet in memory of him, and this year also we are meeting, not with any oration, but a sort of interaction among the homeopathic practitioners. All this has turned out contemplated a few days ago when I was discussing with Dr. Venugopal Gauri. So there are around 5 colleges in and around Hyderabad, and around 400 students are admitted every year, and at least 300 students are coming out of the colleges every year. But among the 300 and odd practitioners or doctors, hardly 50 are practicing, according to rough estimation. Why? When 350 graduates are coming out, not even 1/4 of them are practicing. What is the reason? There are many reasons. This is not a new subject for discussion. We discussed it several times before also. And one reason could be they are scared to practice. Why scared to practice? Because Organon of Medicine, a huge rule book of homeopathy, and there are many commentaries on Organon of Medicine, Kent and Close, Roberts, many experts have made so many comments on Organon of Medicine, which we call as homeopathic philosophy. And chronic diseases by Hahnemann, Bonninghausen. So there is a huge amount of books, literature, and very sadly, all are not in tune with one type of prescription. Where from we get that noise? From there. So Kent's prescription was different, Bonninghausen's prescription was different, and Richard Hughes' prescription was different. And many stalwarts. So as it is, a student is confused after coming out of the college because there are many approaches, many types of prescription. Added to that, some of the practitioners, even in the present period of time, what I prescribe is different from what Dr. Gopal Krishna prescribes or what Dr. Venu prescribes or what Dr. Anandramanji prescribes. There is no consistency. Everyone follows one's own methodology. So the students are confused. The graduates are confused. Instead of all these problems, let us do something else other than homeopathy. That is what the conclusion they are coming to. And some institutions are offering jobs in insurance and in coding and other departments. They are finding it more easy to do that job rather than practicing homeopathy. So we thought, myself and Venu thought that why not we have a discussion among the cross section of the practitioners and find out if we can throw some light on that and find out some via media way for the practitioners to develop, pick up some courage and practice. That is how this program is arranged. This convention, not the something beyond conventional prescription. The caption has been arrived at. Even during Hahnemann's time, all of you know, there was no consistency in practice. Bonninghausen has not accepted the theory of Hahnemann. Hahnemann's theory was subjective symptoms are given maximum importance in the selection of the remedy. I feel hungry or I feel loss of appetite, I feel pain. So whenever a patient starts the narration of his symptoms with syllable I, that is a subjective symptom, and such symptoms are given maximum importance. And Hahnemann had emphatically said that only subjective symptoms really reflect the constitution or the internal condition of the patient. During his time, only Bonninghausen also was practicing, and he has not agreed with Hahnemann. This is not something new I am telling. I am just refreshing your memory. Many of you are already aware of it. So Bonninghausen said, if you give so much of importance to subjective symptoms, if you give so much of importance to the narration of the patient alone, how do you treat a patient who is in coma? How do you treat a patient who is dumb? Or how do you treat a child who cannot express all these symptoms? So I don't subscribe to your theory of giving maximum importance to the subjective symptoms. And then what is the alternative? Hahnemann asked him. He was contemporary of Hahnemann. And Bonninghausen said, instead of this cumbersome case taking, cumbersome questioning, answering, subjective symptoms, objective symptoms, and all that, I have come to a conclusion of in every patient to individualize a patient. He has not deviated from the basic tenet of homeopathy, individualization. But the individualization of the patient need not necessarily be done with subject to symptoms. It can be done by taking 4 or 5 very characteristic and important symptoms from each patient. Sensation, location, modality, and concomitant. That is the theory he propounded. And Hahnemann, that is why, even after 2.5 centuries, I always feel he was the greatest scientist. Why? Not because he has discovered homeopathic law and invented the theory of potentization. He was a great human being with an open mind. When he was the instrument in bringing our homeopathy into this world, he had written 5 editions of Organon by that time, and he is everything about homeopathy. When he was challenged, he did not feel offense. He did not feel otherwise. He has accepted Boninghazen. Who was Boninghazen? He was not even a trained doctor. He was an advocate. And he has challenged Hahnemann, and Hahnemann has conceded, accepted. Okay, go ahead, propound your principle or your ideology, and let us see how people take it. And today, all of you know, more than 50% of the practitioners all over the globe directly or indirectly follow the theory of Boninghazen. Sensation, location, modality, concomitant. And all of us, consciously or unconsciously, we do it. And that is really helping, because that is only the internal condition of the patient which is reflected in the form of signs and symptoms. Your question is something which I answered in the beginning itself. I answered, because just like any other young student, young boy, in those days, it was in 1958, I took admission into homeopathic medical college. Only after my joining the college, state government has recognized homeopathy as official system, 1958. As Dr. Gopalakrishna said, later, many years later, government of India has recognized. But much before that, the government of AP has recognized homeopathy as a system of medicine. So in those days, hardly anybody knew what homeopathy was. So we young people with so many aspirations, dreams, joining a college about which very few people know is something very hard. But still, my father himself was a homeopathic practitioner, and I had no choice also. And I joined. When once I joined the college, I took interest. I have involved myself, totally dedicated, and came out successfully from the college. And in the same college, I was offered a job, teaching job, and I joined there in 1964 as a junior lecturer. Yes, thank you.
Practice my own practice and the is saying I got so much of confidence that he practiced so well. I worked at him for 2.5 years. I never went, I never missed one day also. I was also this. After 2.5 years, I saw many cases and within the months, I saw results, excellent results, sir, and I have so much of confidence in this, sir. So I think this everyone whoever has it, you can ask me, he is very much transparent, he is very much open. So I would like to ask you to my but you always interested in teaching academics or practice, both your first terms.
And this man, Dr. Venkat Raghavan, Raghavan is again Tamilian. He is a Telugu fellow only. He has come all the way from Bhainsa to attend this interaction today. I congratulate him. It's a very good spirit. I was offered a job in my college as a teacher, and I started teaching, and that teaching continued for 30 years. It was also not a choice. It was an accident rather, I can say. So first 3 years I taught there in Gudvada. In 1967, in the name of late Dr. Jayasuriya, a college was started in Hyderabad. So in 67, they were looking for people with some experience. Already Dr. Nagabhushan, my friend, was there as a principal. He recommended my name. So this management wanted that I can come and join, and I shifted to Hyderabad and joined this college. And thereafter, a couple of years, three or four, I think, in 1970, 72. When was government took over? 1972. So in 1972, government has taken over the college, and automatically I became a teacher in a government college. Since beginning, I was in teaching line, and I continued teaching. Practice also was there simultaneously, but it was also practiced, but main profession was always teaching. Even after leaving the college and started a full-time practice also, I have been having juniors who work under me from our college. And as somebody was introducing, telling me around 300 and odd juniors must have worked in my clinic till date.
Good evening, everyone. This is Dr. Scientific, and as everyone knows over here, I'm a professional leader. I used to work as the first experience with them was the first 2 years of my career in homeopathy. And coming from an Indian background, I was always inclined towards religion. But after seeing cases, we treated as things which require a specific intervention. For example, outsiders, inheritors, any ear-related infections. I completely go ahead because it was not, I was not listening to see certain cases being treated with medicines. That is what really me, and that is what I've been using. That is how I pursued my degree in homeopathy. So my question to Dr. Ramchander would be: do you think working in an institution made you a better practitioner, and is really teaching better from clinical practice? Then how practice problem of the third question.
Teaching is nothing different. Teaching is something as per the syllabus we teach. And whatever we teach, we may not practice also. All of you know that, but in Organon, something is said, in philosophy, something is said. But when it comes to practice, we follow our own method. That has been the problem all through. Even now, that is the problem. Somebody in Mumbai practices his own way, somebody else in Chennai practices one's way, somebody in Hyderabad practices. There is no consistency. We meet in several of these All India Congresses, All India meetings, state level meetings, district level meetings. We discuss, we present papers. But when it comes to practice, what we teach, what we learn in college is not consistent with what is being practiced. So applied aspect is always different. Theory is always different. What we teach in colleges is theory, and what we practice in our day-to-day life is entirely different. But practice, studying and teaching, especially I was in the teaching profession, Teaching makes you study more. If you have to go to a class, you should be prepared to answer the questions. You have to anticipate some questions from the students, and for that, from that angle also, you should make a preparation before going to the class. So, as a teacher, the academic side is very well developed, and because it is a teaching profession, medical profession, all the teachers also work in the hospital in the morning hours. So this is a theory as well as the applied aspect also. We should be thorough. We should be able to prescribe. We should be able to show the students how the prescription is working, whether it is working properly or not. So these are all the part of our curriculum. And as a teacher, I must have applied myself more deeper into the subject than many other general practitioners. Definitely, teaching helps in the practice. As a teacher, I did reap the benefits of teaching, benefits of studying more and more to teach the students, and that helps in the applied aspect or in the practice also. Is it the question you asked?
As a practitioner, with less than couple of years under my belt, I see patients who come with a diagnosis. It is better to be given, is it better to be given nosological diagnosis apart from symptoms?
That is not what is taught to us in the college. Hahnemann never said that nosological means diagnosis, you mean. Hahnemann never gave importance to pathology, and you know, if importance is not given to pathology, you cannot diagnose it. So diagnosis was never a part of homeopathic prescription. Theoretically, that's what Hahnemann said. But I, as a practitioner, and as well as a teacher, I never practiced other than the pathological prescribing. In the very early days of my practice, I was following the conventional method of case taking, symptoms, analyzing the symptoms, evaluating the symptoms, and repertorizing. But as the time was passing by and by, and number of patients was increasing, it has been practically impossible to study the patient in that way. Then it was in the late 80s perhaps, I used to see around 40, 50 patients a day. And this conventional method was really difficult. So I am forced to find out my own methodology. Those days I used to get more of cervical spondylosis cases. Many symptoms are common, but still there were some deviation of symptoms from patient to patient. So for every patient, taking so much of a time was not possible for me as a practitioner. Then I thought, why not I find some other method of pathology? The pathology in cervical spondylosis is growth of what we call osteophytes on the vertebrae, cervical vertebrae, and those osteophytes impinge on the nerve roots, causing pain or radiation of pain, etc. So if we can do something to dissolve the osteophytes, perhaps the causative factor of pain will be absent and the patient will feel better. And I started giving calcarea floor 6 as a routine remedy for all my patients suffering from cervical spondylosis. And to my pleasant surprise, it was giving almost 99% result. It was purely pathological. Some patients used to say the pain radiates to right shoulder, left shoulder, or to the spine, or to the head, something. And many patients used to say about giddiness, vertigo, and all that. Irrespective of the symptoms, I used to prescribe. If the patient was very categorical that the pain comes only to left side, I may think of spigelia or something. But by and large, giving dissolving the osteophytes was the main motto, and that worked out. And I, for myself, give preference to the diagnostic labels of each disease. Supposing a patient comes with fever, if it is diagnosed as typhoid, your focus is on some group of remedies, bacteria, gelsemium, something like that. So diagnosis, according to me, helps in the selection of remedy, and definitely taking pathology as a base, you can select a remedy. It is nothing out of the convention to prescribe or give a pathological prescription.
Most of the patients with a particular diagnosis do not have similar symptoms in a complete difference. It would be better to have a group of drugs that have action more on a particular disease. For example, patients with nasal allergies do not speak beyond sneezing, nasal discharge, or nasal congestion. What do you prefer?
I could not get you really, Vivek.
It's a bit, most of the patients, they have a particular diagnosis sciences. Then they have similar symptoms. Almost each and every patient has similar symptoms like sneezing, nasal blockage, and nose. Would it be better to have a group of drugs that have action more on the particular disease?
Not only group of remedies, specific remedies. So let me be honest, that there be no hypocrisy. Simply because I am sitting on the dais, I cannot be something different. If it is sneezing, a particular remedy; if it is nasal blockage, a particular remedy; if it is pain in the sinuses, a particular remedy. The drugs are almost fixed. It is not a conventional method. It may be against the convention, but convention is not important. Relief to the patient is important. So you find your ammonium carb or kali iode for sneezing, kali bichromicum pulsatilla silicea for blocked nose. These are routine remedies, and as Dr. Vivek was asking, definitely not only a group of remedies, but specific remedies for a specific ailment. And we never generally fail. Maybe routine failures may be there 10 20%, unless the patient has a very specific, supposing by and large the patients are sensitive and susceptible to cold. Well, all of us know that as practitioners. Most of the sinusitis patients are in nasal allergy related patients. They are worse in cold months. But there are exceptions like syphilinum, in which the patient is worse in summer. Like that, some very rare patients, rare cases, you may find deviation from the normal routine prescription. Otherwise, all our prescriptions are common and routine prescriptions. Unless the patient comes and says, what sir, it is more than 1 month, 2 months, there is no relief or something like that, then something pinches you, then you focus more and find out maybe some other remedy is also indicated. Otherwise, by and large, the drugs are common, a group of remedies, and those remedies, specific remedy for almost a specific disease. This is also beyond the conventional method.
How important is to consider the repertory, which repertory has served you the best or the prescribing limits?
Repertory is Kent only, right from the beginning. We were taught about Kent in the as students, and later on as a practitioners also, by and large, it is easy. Kent's repertory is user friendly. That is the greatest advantage of Kent's repertory. And mainly I used to practice on Kent's repertory. Later on, some other repertories like NER, very rarely we refer. And burning agent generally I'm not familiar using burning agent repertory, but best repertory is Kent. And every case we don't repertorize. Only when there is some tough case, some difficulty in following up, some difficulty in giving minimum relief to the patient, then only we think of changing the repertory. Otherwise, we don't even consult the repertory. We go by our routine practice, or routine prescription.
As far as the prescription is concerned, how much of totality do you consider? So there are a lot of diseases for a particular person at the same time, like cervical, cervical spondylosis, gastritis, or any other skin condition, sinusitis, which do you really consider the totality, and how is the prescription going to develop?
I have already mentioned partially the answer of it. Because when we take pathology into consideration, we go by a routine prescription, not a particular drug or anything. And the pathology is the basis on which it works. If you refer to the other tumors, you wrote a book on tumor. Nine. Barnett, in his introductory remarks to one of the editions of Borix Medica, mentions that even pathological similarity is not non-conventional. So we have an authority also to support non-conventional prescriptions. And a great man who cured tumors with a small sweet pill, a great author, a great practitioner, he says, even though it is a pathological prescription, you are within the limits of homeopathy. You find that information in Borix Medica introduction by Dr. who said Barnett. So we are not the people who have invented or discovered a methodology of prescribing on the basis of pathology. Pathological prescription has been there. It was only Kent who was vehemently opposing pathological prescription. And Kent's methodology was different. Kent was not at all helpful to present-day practitioner. He was a great doctor, great author, great teacher, great physician, all greats. But he says in one of his lectures on Mater Medica that I would like to prefer to stay in a room where half a dozen Negroes are slashing with razors rather than keeping myself in the hands of a homeopathic practitioner who practices higher potencies indiscriminately. Have you read this? It is there in Mater Medica textbook. Kent's lectures on homeopathic Mater Medica. I would like to place myself in a room where half a dozen Negroes are slashing with razors rather than placing myself in the hands of a homeopathic physician who indiscriminately prescribes higher potencies. This was what Kent had said in his lectures on Mater Medica. And this statement of Kent was challenged by one Dr. Bellacosi. Heard of him? He was a Russian homeopath, migrated to America. Now he is no more. He was practicing in America for a long time, Bellacosi. Very good academician, great author. Many books were written by him. He answered Kent by saying that this paragraph of Veterinary Medica in the textbook should be removed. It should be put under black ink so that nobody can read it. And in the future editions of homeopathy, this paragraph has to be deleted, should not be printed. So vehement. And what he explains, whether it is higher potency or lower potency, unless the patient is susceptible, the potency does not have any effect. And he also explains, if a lightning strikes a granite, nothing happens to the granite. If it is a soft stone, the stone fizzles out. Similarly, if a person is not susceptible for the action of a remedy, however high the potency may be, nothing will happen. So, still there are people who believe that Bellocosi was right. Still there are people who believe Cantor was right. So, ultimately, that is where the confusion comes. That is why what Dr. Venugopal, Gauri and myself, when we were discussing, these things were also had come up. We as seniors, we as others, we as senior most practitioners, we are not consistent in our own theory of practicing. How can we expect a young fellow who came out of the college to prescribe? So ultimately, both of them were right, perhaps in their own way. There was not Kent has got a greatest following in homeopathy. So simply because he said higher potencies are not good for every patient, you cannot condemn Kent. And Bellocosi said that it is not at all a wrong thing. Any potency can be given because the susceptibility is a very important thing. You cannot say Bellocosi was right. So these are all the various opinions, individual approaches in the practice of homeopathy. Have I answered your question? Right. Not necessarily panel, you can also ask any question if you have. Okay, wonderful. Excellent. Keep it away from. Keep the mic away from the mouth.
Despite trying all enforcement approaches, most common cases might be the sinusitis will fail to get success. So how to handle those cases?
Question number?
Cases.
In our practice, we treat common diseases like migraine and sinusitis, and most patients get cured. However, sometimes we fail to achieve success even with these cases, despite trying all possible approaches. Could you share your experience in handling? Every practitioner faces the same situation. If you get 100 patients, you cannot cure all the 100 patients. Maximum patients you can cure, but still there will be a failure. If out of 100, if you cure all the 100 cases, you will not be called a doctor, you will be called a god. Is it not? So always there are failures. Even sinusitis, apparently a very common and a simple problem, but it's not that simple. It does take your time, take your attention, and take your expertise. So generally, what we learned from our philosophy is that when the indicated remedy fails, and when you don't find a way further in the treatment of a patient, prescribe a no-sode, suitable no-sode, and then go back to the old remedy. This is something what is already mentioned in our books. So we must be mentally prepared to treat every case and give relief to every patient. But still, human error is there, our limitations are there, and there are so many angles to that. When a drug is given and it has not helped the patient, it does not necessarily mean that your prescription is wrong. There are so many angles to that. The manufacturer, the distributor, third is your compounder. Whether he has properly packed the medicine or not, whether the store fellow has given you the correct medicine or not, whether the manufacturer has done the right thing or not. There are so many people who participate in one prescription. The last one is the doctor, not the first one.
What kind of diseases should our homeopaths focus to bring awareness on public? What kind of diseases
Right.
should our homeopaths
Good question. Some time ago, maybe a few months ago, our association HAMAT has conducted a seminar in Jim's College. Anybody from Jim's here? So I was also one of the participants in that discussion. What is the question? I lost the chain.
what kind of diseases should
Ah. I asked the students there in the Jim's College, what is the degree you are given after completion of your 5.5 years stay here? They said BHMS. I asked them, what is that S stands for? They don't know. They did not answer. They said surgery. Okay, surgery, but are you doing surgery? No, sir, we are not doing surgery. Then why yes? Are you eligible to have yes in your qualification as BHMS? They could not answer. I only answered, say you are very much eligible because you are also a surgeon in your own way. You are treating tonsillitis, you are treating hemorrhoids, you are treating abscesses. So many surgical conditions, sinusitis, fistula. So these are all conditions which are generally surgical. But you are giving your sweet pill and curing those diseases. So you are a surgeon in your own way. You are very much eligible to have that yes in your BHMS. I said. So to get popularity, we can focus more on the so-called surgical cases. Because arthritis, sinusitis, nasal allergy, migraine, these are all the common diseases which homeopaths generally get in their practice because there is no remedy. Even today, there is no remedy for migraines in mainstream medicine, to my knowledge. So we get so many cases. Even for sinusitis, we are the better practitioners. So instead of focusing on these things, this so-called surgery, small boy of 5 or 6 years or 7 years, taken to a ENT hospital and surgically tonsils are removed. That can be prevented. Very small children of 4, 5, 3 years, adenoids are removed. And many people are afraid of surgery. A maximum people are afraid of surgery. If they have hemorrhoids, you can prevent surgery by giving your remedy. So my suggestion or advice is to the practitioners is that if you focus more on so-called surgical diseases, cure them without surgery, homeopathy gets good name and more popularity. That is one suggestion. There are many other aspects where the other day I was reading in newspaper that what is that Gastroenterology Institute of Gastroenterology. They have discovered or invented a device which will be inserted in the brain to prevent migraine. After so much of research, they found this device will prevent or cure migraine. Research is okay. Research is something which is to find out what is already there or what is not there. What research they have done, I don't know. As homeopaths, all of us are aware how frequently we get cases of migraine, how confidently we can treat cases of migraine, how excellent results we can show to the patient in the case of migraine. So those people who did research, who have gone to the extent of finding out a chip and putting it in the brain, they should also find out whether there is any medicine in the alternative system of medicine. I don't think they have never tried it. Afterwards, you go for a migraine. Is it necessary to put a chip in the brain? Is it that a small matter? And is it available? Is it possible for a common man to go for such a treatment? These are all the so many angles. But people are not aware that we can treat better the so-called migraine without any mechanical procedure or anything like that. Awareness is lacking. That we have been knowing right from the beginning, and we are all trying our best to create awareness. But still, maybe 90% of the people are not aware still, especially in the rural areas. It may be 100%. I don't know. So, focusing on some of the diseases like surgery or surgical diseases, bring laurels to homeopathy, more name to homeopathy. And that is a good service to the many people. I know a woman of 60 years came once for hemorrhoids, very bad case, a lot of bleeding, severe pain. I said, why you don't undergone surgery? Why are you suffering for 30 years? She said, నాకు భయం అండి ఆపరేషన్ అంటేనే భయం నేను చచ్చిపోతాను కానీ ఆపరేషన్ చేయించుకోను. We are only the alternative for such patients. So, so-called surgical cases are better. We focus on that so that we get good popularity for the science.
What is the opinion of first aid homeopathy?
That's a good thing. We should have. That is one reason that is through which we can get more popularity. But only that first aid kit literally should be first aid. They should not dabble with other diseases like say abscesses or hypertension or sugar, diabetic, then mellitus. First aid should confine to first aid only. Then definitely it is useful. A simple fever, simple diarrhea, vomitings, cough, cold, all these things can be controlled. Otherwise, the child is taken to a pediatrician, some antibiotics are given, or if the fever is very high, something else is done. So all that can be prevented by having a first aid kit. It's a very good idea. All of us should encourage people to have a first aid kit of homeopathy in every home.
Establishing homeopathic clinics in rural areas.
You are in a rural area, your place is rural or suburban? No, Bainsa is not a rural area. It's a mandal headquarters.
How important it is.
It is very important, but the thing is, it may take more time to get some patients, to get popularity, to sustain yourself in that village. So socio-economic angles are also to be considered, because in a city like Hyderabad, the awareness is definitely much better than a small villages. Warangal, Nizamabad, Karim, they're all big places where our practitioners, good number of our doctors are practicing, very successfully they are practicing. Some of them are very popular. But in a rural area, definitely we have some problem. We have to face some problems. But if you hail from that place, if you can sustain for a period of time, definitely you can practice in rural areas also. When once the rural people develop conviction in your system of medicine, they will never leave you. That advantage is there. Yes, government dispensaries are there in so many villages. As a policy matter, government has decided to open one homeopathic dispensary in every district headquarters. Mulug. So as a policy, every district headquarters has got a homeopathic dispensary. Rural areas, yes. Government is not opening.
So what methods do you think homeopaths should use based on successful cases? What methods do you think homeopaths should use?
What's your number? What method do you think homeopaths should use? Based on- That's what we are discussing. Methods are already given in the textbooks, in the organon of medicine, in the practice of medicine homeopathically. And method is conventional by and large. But you develop your own method in prescribing. That's what I have been discussing right through. So when I switched over to pathological prescription, I got 100% good result. So I continued to practice pathological prescription. So any method you follow, if it yields results, you can continue to indulge in that same methodology or same practice. But if it is not showing any good results, you can understand as a practitioner, this method is not correct. I have to change the method and follow the convention or whatever it is. So as a practitioner, you yourself find out the method you are following is right or wrong. But there are no definite methods. Every individual practitioner see among ourselves, many practitioners, they give a single remedy. There are some practitioners who give only a single dose. The practitioners who give single dose, they are also sustaining. Practitioners who give a single remedy, they are also sustaining. Practitioners who give multiple remedies, multiple doses, they are also sustaining. In Dr. Stuart's close, many of you must have seen it. In one of his lectures, which is mentioned in the close philosophy, he categorizes homeopathic doctors into two varieties. One is experts, another is bunglers. There are two types of homeopathic doctors. One class of doctors is experts, another class is bungler. He says an expert takes the case, analyzes the symptoms, repertorizes, gives the right remedy, and the patient gets cured. A bungler gives multiple remedies, multiple doses, but ultimately he also cures. Many of us are bunglers. I come under the category of bunglers, no hypocrisy. But I cure. But a straight practitioner, an expert may cure in a short span of time. I may take more time to cure. Cure is something, the ultimate goal of any practitioner. So the methodology also depends on your expertise, your way of prescribing, your concept of the prescription, and your confidence. Is it something what you ask? Okay, next.
What is the role of advertising directed to the benefits of our homeopathic?
Yes, very good. Creating awareness, there are so many ways. All of us follow only one method, that is giving a cure to a patient and that patient going and telling. Venkat, he was my junior till a year ago. He started practicing in a place called Bhainsa in Adilabad district. Some 2-3 months after he set up his practice, a patient came with pain in the abdomen, severe pain in the abdomen. He examined the patient. It was something like a renal colic. He doesn't know what homeopathy is. There is a red cross on his board. He saw that red cross and he came. And he gave some drug like some spigelia or something, or berberis vulgaris, and made him sit there for an hour or two. And there was 50% improvement. And he took some more doses and he went to his village. He is not from his place, a neighboring village. And so far he sent some half a dozen or 10 patients with a kidney pain from that village. So that is one way of our publicity. Mouth publicity, that's what generally we call it. Not necessarily by putting it in a newspaper or a TV advertisement or on that. But nothing wrong in that. In this case, I have an experience. Some 25, 30 years ago, I did in Deccan Chronicle, I used to put a small insertion by paying some 550 rupees or something like that in those days. About small, are you suffering from giddiness? That is the heading. 2-3 symptoms. And consult your nearest homeopath. For further information, contact Shanti Homeo Store. I was never giving my name or anything like that. It really worked a magic. People are not aware that there is a drug for vertigo. They don't know. They keep on swallowing bastal, barchina tablet, mingi, eppuduko mandaru. They are not aware of the availability of remedy. So nothing wrong in publishing, because I have an institution, stores. Under the name of that institution, I used to put some small insertions. Consult your nearest homeopath, or for further information, contact Shanti Homeo. It really worked. But as the time was passing by and by, that small advertisement was costing a fortune. Then I had to stop it. But it did work. It has brought so many patients. And some of my friends also informed me, brother, you gave it advertisement, I believe I am getting patients like that. Because Deccan Chronicle is a very popular newspaper in this part of the state. So, advertising publication is really good. And methodology which we adopt is very important. It should not be like with a business interest. It should be in the interest of the science.
Tendencies we develop come from our parents. When homeopathic medicines are given, there is not tendencies to take any about changes in the genetic code. Is it possible that the animal was so well evolved that it already found a way to change the gene codes through homeopathy? Should research be done on these lines?
Well, most of the chronic diseases are inherited, we all know. And most of the diseases also can be relieved by us. Cured or not, definitely we can give lot of relief to the patient. But was it because of change in the genetic code or not? We don't know. We have to examine the genetic code of the patient before the treatment, and again examine the genetic code after the treatment of 1 year or 2 years, which I am afraid nowhere it is being done. We are spending, Government of India is spending crores of rupees on homeopathic research. Honestly, till date, I don't know what research they are doing. But a largest chunk of government exchequer is spent on research. But really, we don't know. This is a very valid point. This type of research, I don't know anywhere it is being done. Even in our city also, there is a research center. Drug standardization, that is the type of research. What drugs they have standardized so far, I don't know. I know only one thing, regularly they conduct an outpatient department and see some 120 patients. Otherwise, what research they are doing, I don't know. Really no research is being done. So this point is a research point. So take a patient, see his genetic codes, test it, or send the patient to get it tested. Treat him for a period of time, maybe in a year or two, and then again go to the genes and find out whether the change was there in genes or not. So that level of research, to my knowledge, was not done anywhere in the, not only in our country, anywhere in the world. Anywhere in the world, if it is done also, it would have been published in some of the journals and it would have come to us. It has not come to us. But we can, supposing bronchial asthma is there, arthritis is there, eczema is there, psoriasis, these are all genetically related diseases. And we give sufficient relief to those patients suffering from these diseases. Whether genes also have been changed or not, we don't know. We can't say that.
A number of women practitioners want to come back to practice, but they find they are in without restricted. What is the scope for learning and come back? Women practitioners.
A number of women practitioners want to come back to practice, but find that they are at sea as the turf has shifted. What is the scope for learning and come back? This is one very important point. Why homeopathy is not practiced widely is because of lady doctors that come out of the college. 90% of them, or at least 80% of them, do not practice. I wrote an editorial also in Medicine of Future a long time ago. Why ladies are not practicing? It's not the fault of a girl. There are many other things. We have analyzed it, all those 1, 2, 3, 4. Long time ago. I know whether any one of you had seen that editorial. So soon after they come out of the college, there are many girls are around 22, 23, 24 like that. Parents' first priority is getting the girl married. Not the clinic, not the establishment, anything like that. So when once a girl gets married, she is lost. She won't be in Hyderabad, she may be somewhere else. Even though she is in Hyderabad, she is in something else. So the whole line is disturbed. Now the question is, if a young lady who comes out of the college, takes the degree, does not practice, after becoming a mother of 1 or 2 children around 40, 45, if she wants to practice, is there any room? That's what is question. It's a very good question. And at present, one of my juniors in the clinic is around 40 plus. I don't know her exact age. Soon after passing out of the college, she worked as my junior for a couple of months. Then her marriage was fixed. So she has gone. For 20 years, I have not seen her. Now, some time ago, she came for a spur calcaneum, pain in the heel. She came with her husband. And one of the juniors wrote the case. సార్ మీ జూనియర్ అంట సార్ మీ దగ్గర పనిచేసిందంట మీరు పెళ్ళికి కూడా వెళ్ళారంట ఆమె పెళ్ళికి అని చెప్తున్నాం బట్ ఐ డి నాట్ రియల్లీ రిమెంబర్ హర్ బట్ ఐ ఆస్క్ హర్ వాట్ ఆర్ యూ డూయింగ్ నౌ హౌస్ వైఫ్ నో ప్రాక్టీస్ 2 children bringing them up and taking care of husband in-laws 5 years చదివావు కదమ్మా నువ్వు రాకపోతే నీ సీట్ ఇంకో పిల్లవాడికి ఇస్తే వాడు ఏదైనా చదువుకుని ప్రాక్టీస్ అనేది చేసుకునేవాడు నువ్వు ప్రాక్టీస్ చేయవు సీటు పొడగొట్టావు వాడికి అని కోపడ్డాను దట్ ఈస్ ది యూజువల్ వే ఆఫ్ ఐ డీల్ విత్ ఆల్ మై స్టూడెంట్స్ హూ కమ్ ఆఫ్టర్ సో మెనీ ఇయర్స్ దే సీ మీ సో ఆఫ్టర్ గోయింగ్ హోమ్ హస్బెండ్ ఆల్సో వాజ్ దేర్ ఆయన ఏదో క్లాస్ బీకినట్టున్నాడు ఇంటికి వెళ్ళినాక ఆమె నెక్స్ట్ డే ఇచ్చేసింది క్లినిక్కి సార్ నేను మీరు పనిచేస్తాను సార్ after 22 years. This is exactly the question you asked me. I said, okay, most welcome. Actually, there was no room. Already 2 juniors are working. But anyway, at that age, she had come with so much of enthusiasm. I thought I should not discourage her. I said, okay, she has been working. It's already 2 years since she is working. She picked up a lot, wonderfully. She developed, she picked up. She regained all the knowledge, very good at case taking, repertorization, everything. Because that whole knowledge is somewhere in the layers of the brain, it is there, and that had come out slowly, slowly, and she has come up to the level, bring. So it's the only alternative or only solution to such women is that they have to work again in an institution, maybe a practitioner, maybe a hospital, and try to focus themselves on the subject, clinical side, applied side. Definitely they come up. It's a very good question. And such women should be encouraged because they are not bothered how much income is there. They are bothered about their practice. They are more interested in focusing on the patients. Such people are useful for homeopathy as a profession. Because young people, soon after passing out of the grad college, if they go and start the practice, from day one, he will be applying how much I got this month, how much I am going to get next month. The whole focus is on the economics. That will impinge your focus and diverts your focus from the most important aspect of applied homeopathy to something different. Yes, next.
Sir, on similar lines, how many students continue homeopathic education under hospital education? And the market offers many jobs to get the graduation. Homeopathic practice and success. How can homeopathic practice get you in short time? And you want success in a short time. How to earn money through homeopathy practice alone? That's the last one.
64. అయిపోయింది how to make students continue homeopathic education as a prospective career, as the market offers many jobs to a homeopathic graduate. Homeopathic practice, startup, and success can be achieved in a short span. As youth want success in a short time, success cannot be achieved in a short time. How to earn money through homeopathic practice alone. అంటే homeopathic practice alone అంటే అలోపతి హోమియోపతి రెండు చేద్దామని. Necessity is the mother of invention. And once you start your practice, how to earn money, nobody need to tell you. You yourself will learn the art of earning money as well as art of practicing homeopathy. Homeopathy itself will teach you, or your patients themselves will come forward and pay you. So all that you have to do is focus on your prescription, focus on your attitude, focus on your treatment. That will automatically get you popular as a practitioner. And day after by day, your practice will improve. But success cannot be achieved overnight. Success do come in course of time, depending on your devotion to the cause of homeopathy. Homeopathy will never let you down. Dr. Ingling wrote a small treatise on Accuser's Emergency Manual. I studied long time ago, whether it is available in the market or not. Ingling was the name of the doctor. Accuser's Manual of Homeopathy. Accuser is an obstetrician. In that he says, if you are a devoted homeopath, homeopathy will never let you down in an emergency. This is one angle which many of us are not focusing on. Hardly any one of us takes up an emergency. Emergency is, I'm not talking about diseases like acute abdomen, where surgery is an essential. I'm not talking about what we call strangulated hernia, where surgery is a must. I'm talking about a fever with 104, 105 also. Our graduates ask them to go to a nursing home nearby. That confidence they are lacking. Confidence is lacking because they are not exposed. Exposure is practically nothing in our institutions. I am a part of the institutions. I am not criticizing anybody. We are only discussing the facts. A student is not exposed to any type of emergency. When you are not exposed, how can you develop confidence to treat the patient? Only on seeing the patients being treated, you will develop confidence. It's the applied aspect. Homeopathy is a practical science. So unless you see the patients improving with medicine, you will not develop confidence. So that type of confidence institutions are not able to inculcate among the graduates for obvious reasons. Even Central Council chairman visited our institution. We appealed to him, at least ensure that emergency department is started in homeopathic teaching hospitals, if not in all the hospitals. Nothing has been done because it's a policy decision to be taken at a very higher level. Nobody has focused on that as a matter of fact. If they focus it on the issue, some solution can be definitely found. There cannot be a problem without a solution. But to find out the solution, one should have determination and interest in that. Yes. So nobody is focusing on that. At our level, we cannot do it. It has to be done at the government level. And people who are in government also are approached about this point. Nobody is bothered why so many graduates are not practicing. The reasons are very simple. Reasons are very clear. The only thing lacking is application by the authorities for the problem. So they are not finding a solution, and the problem remains like that. Even when I was a student, this problem was there. Even today, the same problem is continuing after 60 years. It seems to be that it continues further. So we cannot depend on anybody. We should find out our own methodology. As a matter of fact, some time ago, from this institution, an idea was floated to give training. One of my juniors, she is here, after she passed out of, what is that, Mangalore, Father Muller. She passed out of Father Muller's college. And later on, there is one institution in Pune, which runs a 100-bedded hospital, homeopathic hospital. And there they give internship to all homeopathic doctors who took the degree. She paid 5,000-6,000 every month, and she worked in that hospital for 6 months to gain some exposure of seeing various cases. So, but when this institution came forward to train graduates like that, for some obvious reasons, nobody came forward and that program has been shelved. We actually prepared a syllabus also, if I am not wrong, how to train up the graduates, what sort of a training should be given. Ever munduku rale, మేము వర్క్ చేస్తామని nobody came forward, no applications for it. So we just shelved that project. So the only thing is that gaining popularity, practicing, gaining money, getting money, all that is surrounding one point, your focus and your interest on the subject of homeopathy.
Question number 16. Every system of medicine has moved on. Today, mainstream medicine, for example, has fine-tuned itself to a good extent, say diagnosis. How important is that research for us in upgrading our prescriptions, or would the same data be of use for us in giving homeopathic remedies?
As a matter of fact, we have a very clear methodology in the drug selection. We need not necessarily depend on diagnosis. Depending on diagnosis is not wrong, but want of diagnosis should not hamper you to prescribe, because we take the patient into consideration, not only the disease. Dr. Venu sent me some literature I was going through. In that, Hahnemann, in his last days of practice, was giving dual remedy prescription, two remedies to a patient. One remedy orally, one remedy olfaction, something like that. It was something different from the methodology followed in, described in, enunciated in Organon of Medicine. Two remedies. And he was also talking about diseases, not the constitutions. These were all developments over a period of time. I always feel, had he lived for another 10 years, he would have done some more miracles in homeopathy. He would have disowned his own theories. He never mentioned about constitution in the last 8 years of his practice. Last 8 years of his practice was in Paris with his second wife. He never spoke about constitution. He never spoke about single remedy. He never spoke about the what we call miasmatic treatment. He had very good practice in Paris for 8 years. Some 36 case records of the practice of both Hahnemann and his wife in Paris were collected by somebody. And that somebody wrote an article long time ago in a journal called Hahnemannian Gleanings. Many of you may not have heard of it. Dr. J.N. Kanjilal was the editor. That Hahnemannian Gleanings was one of the standard journals published in our country. In that journal, an article was published by one doctor who had an access to those 36 case reports of Hahnemann and his wife, which while they are practicing in Paris. So it was a revolutionary revelation that nothing about constitution was mentioned and nothing about miasms was mentioned. It was only symptomatic treatment or maybe pathological prescription as well. So allopaths can prescribe unless it is diagnosed. By homeopath need not necessarily wait for the diagnosis. Our diagnosis is homeopathic, our diagnosis is symptomatic, our diagnosis is miasmatic. So our guidelines are different. If you also combine pathology or diagnosis, well and good. So lack of diagnosis does not hamper a homeopath from going ahead with the treatment or practice. Is it okay?
Number 17. Today, 66% of Indian population over the age of 40 years are suffering from some non-communicable disease like diabetes, hypertension, hypothyroidism, metabolic syndrome, etc. What is the role of homeopathy in this field, and how do we keep update others for the challenge?
Well, that's a good question. Many of you must have read, must have observed B.M. Hegde's videos. Have you? He himself is a great allopathic surgeon, cardiothoracic surgeon. But his thinking is absolutely homeopathic. He is a homeopath by nature, by observation, by giving his ideas to the generation. He says diabetes is not a disease. It is an ATM to an allopathic doctor. he never accepts diabetes as a disease, thyroid as a disease. The only thing is that we as homeopaths, we lack courage to take up such diseases. If we take up that disease, if we cannot give relief, if something happens to the patient, we are accountable. We will be made responsible for that. So, why taking risk? Let there is a diabetologist around the corner of the street. Let him take the responsibility. Why should he bother? Thyroid is not a disease at all. Why are we all consuming iodine? All of us are consuming iodized salt. Is it warranted? Are you having any iodine deficiency? It is the extra iodine that is acting as poison and causing hypothyroidism. I tell all my patients, almost 90% of my patients are thyroid. They don't come for thyroid. They come for arthritis, they come for asthma, they come for something else, also have thyroid. So my first instruction to the patients is that avoid taking iodized salt. It is not necessary for you. It doesn't really help. Iodized salt, non-iodized salt is not available in the market. That is one problem. So they find out somewhere in the corner store, they find out, they pick up and they stop eating iodine. So some 30, 40 years ago, hardly one case of the hypothyroidism. We used to call it as myxedema those days. I used to treat in once in one case in a year or something like that. Today, every day we get a case of thyroid. So there is something wrong going somewhere. Otherwise, when it was not rampant 30 years ago, why it is rampant today? Nobody has focused research which is going at various levels. Why they have not done? You find in that dictionary, what is that medical dictionary? Tabor's medical dictionary. A small sentence is written that extra iodine may cause as poisonous, symptoms of poisoning, iodine poisoning. That iodine poisoning is our hypothyroidism. So stop iodine first, then give some drug. Our drugs help. You can stop. Patients take 150 micrograms of thyroxine hormone every day. 150 micrograms. We reduce that to 100, 70, 80, 25 last. We ask them to over a period of time. So we can very successfully tackle these diseases. Honestly, I have not treated any case of diabetes. I did treat, but I never ventured to ask the patient to stop taking allopathic medicine. Because diabetes is a multidimensional disease. It has effect on nervous system, it has got effect on eyes, it has got effect on many other organs, vital organs in the body. So we cannot experiment on any patient unless you are confident about. Not that homeopathy cannot treat diabetes. Diabetes also can be treated. Only thing is that I don't know, these research scholars spread all over the country, spending millions of homeopathic budget. What they are doing, what sort of research they are doing, I don't know. But to my knowledge, no positive tacit information about homeopathic treatment of diabetes has come out. Thyroid, definitely we can treat. Hypertension also we can treat with some restrictions to in the diet and lifestyle of the patient, definitely. But only thing is that we are not able to extreme degree of number of patients we are not able to treat because of our own limitations in understanding the disease and treating the patient. So research scholars, research institutions should focus on these subjects because they are very rampant. Every alternate person appears to be diabetic and hypertensive in these days. Maybe many other factors are also playing an important role in causing these diseases. So while addressing all the other problems, homeopathy also can be tried for a period of time with very successful results. Any more questions?
So number 90. Today, there is so much of reliance on over the counter drugs. like oral antibiotics, painkillers, anti-inflammatories, antibiotics in mainstream medicine. How do we match up to this reality? Demand and in a way, increasingly this modern medicine.
It is a reality. It's a reality. According to one statistics, 40% of patients in our country, they are treated by medical stores. They don't go to a doctor. They go to a medical store and ask the counter fellow to give medicine for diarrhea, dysentery, headaches, fever, something. 40% of the patients are treated by medical stores. And in Bonalu is going on now in the city. In Lashkar Bonalu in Secunderabad, it's very highly celebrated there. Every year, after Bonalu festival is over, one lady gives a program called Bhavishyavani. She tells what is going to happen to the state in the coming 1 year. She is supposed to be in a trance. I don't know whether it is what sort of a trance it is. So this time she said, usually she talks about rains, crops, any chronic, any epidemics that may affect the state, the plus points, minus points in the ensuing year she tells. This time she said very surprisingly, I read in newspaper, don't consume too much medicines. This is what the advice she had given to the population of Telangana. Don't consume మందులు తినకండి అని చెప్పి మందులు అంటే ఆవిడ ఉద్దేశం హోమియోపతి ఆమె తెలియకపోతే ఆమె తెలియకపోవచ్చు మందులు డెఫినెట్లీ షీ మీన్స్ అలోపతిక్ మెడిసిన్ ఎందుకు చెప్పిందాం అట్లా అనేది నాకు కొంచెం ఆలోచించాను ఆర్ వి గోయింగ్ టు గెట్ అనదర్ ఎపిడమిక్ లైక్ COVID or something where lot of rampant medication was done. WHO said some 4 drugs are useful for COVID and people bought 100 rupees medicine for 1,000 rupees, 10,000 rupees. And after 4 months, same WHO said all those 4 medicines were useless. It has come in newspaper. I don't have any separate information. So this lady was telling Bhavishyavani, don't consume more medicines. ఆమె అట్లా ఎందుకన్నది అనేది నాకు కొంచెం ఆలోచన వచ్చింది. We are in an impending danger of some disease or something, or is allopathy going to manufacture some more drastic and more dangerous, more side effect medicines? I don't know. Whatever maybe, that was the narration of that Bhavishyavani. So these across the counter medication is always dangerous. And some of the scheduled drugs which are not sold across the counter in many developed countries are sold across the counter in our country. You can get any type of medicine across the counter, including sedatives. People buy tens and dozens of tablets, consume and commit suicide. It is a very easy method of committing suicide. So across the counter medication is definitely not advisable, number one. Number two, one of the homeopathic practitioners in a casual discussion was telling the reason why homeopathy is not becoming popular as that of allopathy. One of the reasons he said was it should be easily available for the patients. If a patient gets a headache, goes to a medical store and asks a pill for headache, he swallows it. But he cannot go to a homeopathic store and ask the counter fellow to give a medicine for headache. He will ask which side of the head you have got pain, whether it is more in the morning or more in the evening. That is one of the reasons for homeopathy not becoming popular. Whether as a regular trained doctor, you don't agree, because we have a science, we have a methodology, we have certain rules to follow in the prescription. So nobody can question us, why are you following the rules? But if the rules are kept under wrap for some time, And you also prescribe something as per the label of the disease, headache, this medicine, diarrhea, this medicine. Maybe homeopathy also becomes more popular. Almost that stage seems to have come. Many stores have got, I am really surprised. One manufacturing concern in Hyderabad is making, what is that, in kidney failure, what is that toxin? Creatine. Creatine in 6x. Creatine 6x. So we are also very fast catching up these across the counter medication, label and the name of the disease and the drug. Maybe the time is not far away that we also get equal popularity. Maybe creatinine helps. I don't know where from that creatinine is taken, whether it was proved. Definitely, obviously, it is not proved because according to 1960 and 1845 Magic Remedies Act, no medicine should be prepared with the name of the disease. That is the instruction given in that act. Nobody, you can't say headache 6x, can't say. So creatinine 6x also is something like that. But there is nobody to check it. Nobody, the person who has to check it also does not know that there is an act and that clause is there in that. That is the situation here. So as Dr. Gopal Krishna was asking, across the counter medication gives definitely more popularity. But as homeopaths, we cannot officially follow that methodology because we cannot specify the remedy for a specific disease. So Rikwik has been doing it over years very successfully. Why WHO has not recognized homeopathy till date is because of Rikwik. Because the economics, according to the economics, a large chunk of public money is collected by homeopathy. That is why allopathic drug industry does not allow WHO to recognize homeopathy. So all of us wonder, what is that? We are not earning millions of rupees like drug industry. Why this restriction? You and I are not responsible for that. Firms like Rikwik, which manufacture 1 to 100, 190, something like that, all over the world, especially many homeopaths who practice allopathy, they are the main supporters of that Rikwik numbers. Because the disease name is given, number is given, it is easy to prescribe. They are encouraging that, and many others also. You just go to a counter and ask for so-and-so number for hypertension, for diabetes, or for arthritis, something. So that being done now, and but that is not definitely in tune with good encouragement to homeopathy. Homeopathic drug industry may be benefited, but not public as a patients or doctors as practitioners.
Cases where there is the usage of immunosuppressant drugs like in dialysis or in transplantation.
Organ transplantation, invariably they are under allopathic medication. We never had an opportunity to treat any organ transplantation. And when once organ transplantation is done, they always give immunosuppressors. Otherwise, the implanted organ will not remain in the body as of now. But I never had an opportunity to see any case of organ transplant in treated homeopathically. And autoimmune, yes. The exact cause of autoimmune is not known, but many, even psoriasis, we do get every day a case. Psoriasis patients also, they are autoimmune, and our drugs really act. In so many ulcerative colitis are cured, a good number of cases of ulcerative colitis, which is supposed to be autoimmune, and rheumatoid arthritis. Many autoimmune diseases are amenable. I don't use the word cure, are amenable for homeopathic treatment. Definitely, with confidence, we can treat Without side effects, we can treat. And for all autoimmune diseases, mostly steroid type of medicines are given in the dominant school of medicine, which produce many side effects. All of us are aware of it. Even the practitioners of allopathy also are aware. Because they are helpless, they don't have any other alternative. But we have alternative, especially rheumatoid arthritis, ulcerative colitis, psoriasis. These are all autoimmune diseases. Yes, homeopathy definitely has an answer for autoimmune disease.
So what is your take on efficacy of homeopathic medicines in alcoholic smokers, gutka and pan users?
There are two types of addictions. If I want alcohol, but I want to stop drinking, but I am not able to stop it because of my weakness, mental weakness. Drug may help me because it will give more sustenance to my thinking, my strength of my brain, and I may be able to stop it. But there is other type of alcoholics who say, I never stop it. You give your own medication, you try your best, but you can't stop me from drinking alcohol. For such people, I'm afraid no medicine can help. You got my point. If one is interested to stop it, but unable to stop it, drug may help. We did help some patients like that. But ఏ మందుని ఇవ్వు నన్ను మాత్రం నువ్వు ఆపలేవనేవాడిని ఎవరు ఏం చేయలేరు ఇక ఏ మందు పని చేయదు ఇక అంతే.
No consistency in treating patients. How to manage? Patient, for example, patient eats if there is no anything in first visit.
ఏ నెంబర్ చెప్పు.
27. No consistency in treating patients. How to manage? For example, patient eats if there is no anything in first visit.
If there is no relief in first visit, let him come second time. Second visit will relief వస్తుంది. See, you can't expect every patient to get relief in the first visit itself. First visit, we take the case, we study the case, we prescribe, and how he reacts, we'll see. Next we give prescription. Whom we have to give, see, fortunately or unfortunately, 75% of our patients are chronic patients. Nobody is bothered about giving relief on the first visit. And the remaining 25% acute cases also come to us from these 75 old patients, chronic patients. Their children, their grandchildren, their relatives, they are only referred. But no patient, a new patient with fever or acute problem hardly comes to any homeopath. That is the successful record we have created as homeopath. No acute patient comes to us, only chronic patients. What little patients, acute patients come also from these chronic patients. So first visit, how do you expect anybody to get relief in the first visit? Unless you are a very divine practitioner or an expert practitioner, very first prescription may not give total relief. There may be some amelioration. And again, he has to come second time, third time, he keep on visiting till the patient gets better. Are you satisfied? Even if you are not satisfied, there is no alternative.
How to keep that good and that weak for any chronic condition when women should understand it without much clinical knowledge. 20
అదే కదా మాట్లాడుతున్నాం ఇందాక నుంచి మనం మాట్లాడింది అదే. The protocol of teaching has to be changed. Every hospital, teaching hospital, should have an emergency department, and the students should get exposure to emergencies. We don't have a department called casualty. We see that in allopathic hospital, but I never saw, I visited many homeopathic hospitals in the country. I never saw anywhere emergency department. So unless you see emergencies, that is your question is that only, no? How to define the protocol of and pass plan of treatment for any chronic condition, there is no problem. Chronic condition, you have enough time. Arthritis patient, usually we get osteoarthritis. Rheumatoid arthritis is a different plan altogether. So all chronic diseases, we have enough time to plan the treatment, take this treatment, decide the drug, give the drug in 30 potency or 200 potency, or you give the follower, the cycle of remedy, sulfur, calcarea, lycopodium, like that. Some cycles are there. So for chronic treatment, there is no problem. The problem comes only with the acute treatment, no protocol. Every patient is individualistic. If the patient has got dehydration, you may have to give your remedy and also give some IV fluids. It is a must. Dehydration has to be tackled at both the levels, dynamic level as well as physical level. So the plan of treatment depends upon type of case. In chronic diseases, you have plenty of time. You can plan it according to mathematics or according to totality of the symptoms or according to the constitution. And as the method you follow in your clinic, you can apply the same methodology. And for acute diseases, every patient needs a specific type of approach, specific type of treatment, depending upon the requirement. Once a patient, a boy of 9 or 10 years was brought with 106 temperature. I gave belladonna, asking the mother of the child to give it every 2 hours, 3-4 times, thereafter every 4 hours. And the patient went away. The junior doctor sitting beside me was still, sir, the patient was having such a high fever. If the medicine does not work, the boy would have may go into convulsions or maybe brain damage. You could have asked them to go to the nearest nursing home. Then fear started in me. Till then, I never thought about it. I gave a prescription and I sent away the patient. And ever since that girl said that it's a fact. What she said is the truth. High temperature can damage the vitals. So I was really very much worried the whole night. I couldn't get sleep. And morning 8 o'clock, the mother rang up. మా జ్వరం తగ్గింది ఇంకా వేయాలన్నా గోళీలు ఆపేయాలన్నా అంటే I felt relieved. But sometimes in our own hurry or anxiety or whatever you may call it, we do sometimes mistake. It was a mistake. Such a high fever child should be treated in-house, in the hospital, where there are facilities for intravenous solutions, in infusions or in oxygen or any other method of help should be there. And you can't just like that give a few doses and send the patient. That's not good. We do sometimes that also comes under a protocol. These protocols have to be decided on the spot depending on the type of patient you are in hand.
The democratic file. What is your resolution as a practitioner in prescription and selection of remedies from your beginning days to now? And how many times?
Question number?
What is your evaluation as a practitioner in prescription and selection of remedies from your beginning days to now?
In the beginning, I used to be very careful, very cautious. As the time is passing by and by, so much of caution is not there. So much of care is not there. It is because of a sort of confidence I gained over a period of time. Confidence I gained after seeing number of patients over a period of time. So definitely It has to be like that. It cannot be otherwise unless there is something wrong with you mentally. For a period of time, confidence levels have boosted up. I am in a state of mind that I can accept any type of case depending upon the situation. One of my nephew's wife became unconscious and she was removed to a hospital where she was diagnosed cerebral hemorrhage. And very sadly, craniotomy was done and the lady passed away after 2 or 3 weeks. A dose or two of arnica 10 would have saved that lady. But these are post-mortem thinking. But no information was given to me. They did not allow the family members to think also. So they said that unless surgery is done within half an hour, the patient may pass away. So they said, okay. They opened the brain. However, she passed away after 2 or 3 weeks. 2 weeks, I guess. So the confidence comes with experience. Confidence comes with exposure. Confidence comes with your knowledge. Knowledge also improves. Every patient teaches us. We learn from every patient. So as the time is passing by and by, you need not worry about any case you get. You can confidently treat, assure the patient of a cure, and that is what is the advantage with the experience of any practitioner. Is it what you wanted? This is the question.
Sir, analysis was a hero every time in evidence case. Whether it was or whatever. The popularity of homeopathy peaked. When COVID hit by this time, have the homeopath, the generation of homeopath, made you proud or they have made you feel sorry? Because during the first lockdown of COVID is over, we were not even allowed to treat patients. And later also, we have seen not many clinics dying. They have taken in this volume to transportation and not many homeopathic practice. The few ones are coming to the stage because of that. What is the stage for COVID and the impact on homeopathy?
It was a great assault on homeopathy by Government of India. It was an assault on homeopathy. Homeopaths were not allowed to treat patients. So sad. Millions of rupees government is spending, recognized system of medicine. They are not allowed us. See, always in government, a procedure is followed called following the precedent. Supposing there is a flood situation, and there is a discussion among the government officials how to go about it, how to control it, whether to send boats or whether to send swimmers to save the people, something like that. Then the method followed is, in last 2-3 years ago, we had a similar situation. What did the government do at that point of time? So we have sent 100 boats to rescue people, something. Let us do the same thing. So always in government, a system called following the precedent. అంటే అంతకుముందు ఇదే సిచ్యుయేషన్లో ఏం చేసామో అదే ఇప్పుడు చేయాలి అనేది ఫాలో అవుతారు. That precedent also is not followed by the government. In 1982-83, there was an epidemic of brain fever in Andhra and a part of Telangana, Nalgonda district and 3 districts in Rayalaseema. Children were dying. Between age group of 6 and 12, children were dying. And Hygravachari was our health minister. Many of you may remember him. He is no more. So he called all of us. I was additional director. All of us were called there. He said, ఇట్లా పిల్లలు చచ్చిపోతున్నారయ్యా, 5-6 ఏళ్ల వయసు వాడు చనిపోతున్నారు. నేను డిఎంఎస్ని కూడా పిలిచి డైరెక్టర్ ఆఫ్ మెడికల్ సర్వీస్తో మాట్లాడితే వాళ్ళ దగ్గర ప్రివెంటివ్ ఉందన్నారు బ్రెయిన్ ఫీవర్కి. మరి ఉంటే మీరు ఎందుకు వెయిట్ చేస్తున్నారు, వెళ్ళి ఇచ్చేయండి పిల్లలకి అంటే 1250 శాంపుల్స్ ఉన్నాయంట వాళ్ళ దగ్గర. 1 crore people have to be immunized against the disease. 1 crore children in erstwhile Andhra Pradesh. They have got 150 samples. ఎవరికి ఇస్తాడు ఇది తీసుకెళ్ళి? ఒకడికి ఇచ్చి ఒకటి ఇవ్వకపోతే నన్ను చంపేస్తారు. కాబట్టి వాడి చేతులు ఎత్తేసినట్టే మీరేమన్నా చేస్తారా అని అడిగాడు ఆయన. అడిగితే డెఫినెట్గా చేస్తాం సార్, ఎపిడమిక్ అంటారు దాన్ని. ఆ ఎపిడమిక్ని ఎట్లా ట్యాకిల్ చేయాలనేది హ్యాన్మన్ చాలా క్లియర్గా ఆర్గనాన్లో చెప్పాడు. కాబట్టి మేము ముందు వెళ్తాం అక్కడికి, ఆ పేషెంట్స్ ఎక్కడున్నారో చూసి స్టడీ చేసి ఏం డ్రగ్ వస్తుందో చూసి అదే మేము ప్రివెంటివ్గా ఇస్తామంటే ఇమ్మీడియట్లీ ఈ ర్యాంక్ అప్ ఆల్ ది డిస్ట్రిక్ట్స్ వేర్ ది డిసీజ్ is prevailing. All the district collectors were alerted, and he said a team of doctors is coming from Hyderabad, make all basic requirements, see through it that they get all facilities. They are going to study the cases. So I went there, and along with me a number of doctors. We visited Kadapa, Kurnool, Anantapur, and Nalgonda. These are the places that were affected. District headquarters. So we went there, saw the cases admitted in the district headquarters hospital. We recorded the symptoms. Belladonna was the genus epidemicus. So we decided Belladonna as the genus epidemicus. Rang up Hyderabad, they bought hundreds of bottles of Belladonna 200 dilution. We have sent them to schools in affected areas, and we have taken distilled water 450 ml bottles. We add some 2 or 3 drams of dilution in each bottle, shaken and given drops to all the students. Lakhs and crores of 1 crore children in such a big state. And we have very successfully controlled the epidemic. Very successfully. That is the precedent. So our bloody government could have taken that as a precedent and allowed homeopaths to treat COVID. On the other hand, they put a ban on homeopathic prescribing. It is so sad. Definitely, we could have done much more than what they have done. What WHO said had to withdraw its own statement that so many drugs which they have announced as a remedy for COVID, they have withdrawn, then said all the 4 remedies are not useful. They bought the remedies for 30,000, 40,000 also, I believe, in those days. Minister's recommendation for buying the medicine. Ultimately, it was found that those medicines are not helping. So in COVID, government, both at government, state level, at central level, have done great injustice to the people of India by not allowing homeopathy to practice or to be given to the patients. It happened.
When do you consider giving all of remedies, prognosis, starters, and causes?
Number?
What is one?
When do you consider giving follow-up remedies, no source, etc.? How often do you use sarcodes? Well, in the Materia Medica, definite guidelines are given when to give a nosode, when to give a sarcode and all that. But I am not a conventional homeopath. I frequently use their sarcodes. Frequently, even thyroidinum is a sarcode we give to all patients regularly on regular basis. And because I ask them not to take 150 mg, 120 mg and all that. And nosodes also, mostly symptomatically, we can diagnose the psychotic patients or syphilitic patients. Modalities only are mainly the concern for the selection of the remedy in any patient. So also there is no special protocol for the prescription of nosodes or sarcodes. It is like any other remedy. As the symptoms call for it, we give it. And routine prescription of thyroidinum, which is a sarcode, is given to all my thyroid patients. Whatever may be the other remedy I give, I also give thyroidinum 6C every morning on empty stomach. very good results are there. They are slowly reducing the quantum of this allopathic hormone. And now 25, sometimes they stop that also. The results are quite good.
Number 21. Please give your opinion about allopathic vaccination in children. 31.
I never got my children vaccinated. But if I say that to my patients, they don't agree. They don't oblige me. Not that if you don't give vaccine, the child gets the disease. But unfortunately, the child gets the disease. They attribute that to non-giving, non-vaccination. Many children were vaccinated against chickenpox. And a majority of them had an attack of chickenpox. So not what Hanuman said is a different thing, but even as practitioners, we find in our day-to-day practice, vaccination is not really helping in giving immunity to the children. Of course, smallpox has been eradicated. When we were children, there used to be attacks of smallpox, and now there is no smallpox in our country. And how many other diseases have been eradicated, I don't know. I know only about smallpox. Poliomyelitis, right. Poliomyelitis also is almost eradicated. But it is eradicated because of vaccination or due to natural causes also, we don't know. Vaccination is something nearer to isopathy or homeopathy also. But our prescription is in the potentized form. Vaccination is in the crude form. It may have some toxic effects. Even COVID vaccine, there is a very wide understanding among the public that many cardiac arrest cases were due to COVID vaccination. But we have no proof of it. We cannot prove it scientifically. But it is being discussed among even medical circles, not only homeopathy, in general medical circles, that COVID vaccination has been doing a lot of damage to the people.
How have advancements in technology and machine learning, how have advancements in technology and machine learning impacted the approach of
Number.
homeopathy?
How have advancements in technology, such as artificial intelligence,
What are the latest search engines that have been
factor your approach to homeopathy, test taking and remedy selection, which is specific artificial intelligence you recommend for the modern? I don't think artificial intelligence is introduced to homeopathy. Like that, it is a new technology to any science, to any branch of the technology. It is yet to be seen, experienced. Nevertheless, homeopathy for any system of medicine, artificial intelligence, how much it is being used. Maybe it is helpful in the diagnosis. I don't know. I have least idea about it. And other technologies is our repertory has been digitalized and it has been computerized. Very good computer digitalization, the repertories are available. It makes your job easier. Before computerization, there used to be what is called card repertories. Dr. Jigal Kishore also has prepared a card repertory. Dr. P. Shankaran, Rajan Shankaran's father, he also prepared a card repertory. That was one mechanical device to reduce the labor of repertorization. Later on, computerization was done. Now, very good computers are there. Computerization of repertories are there. That is also technologically very useful, and definitely everyone who has access to it should use it for better practice and better application of the remedies. Artificial intelligence, I have no idea.
What emerging trends do you foresee in homeopathic practice? How can practitioners prepare for these changes?
Among the emerging trends, we may quote about corporate homeopathy. It was also a new one, new development. And what good corporate homeopathy has done to the science, I don't know. But one obvious difference, what I found as a practitioner after the advent of corporate homeopathy is that earlier when we were demanding some 500 rupees fees, patients used to hesitate. Now they are not hesitating. So they got used to paying higher amounts to homeopaths. That is one advantage after the introduction of or development of corporate homeopathy. And which one you said? 31? 34. 34. This is also a part of what we have already discussed. Any particular methodology to make it more popular or to make it more useful, it all depends on one's own interest, one's own application of oneself to the science of homeopathy. So the method we follow is all our own easy method, quicker method, and giving some sort of relief to the patient is perhaps following the pathological prescription.
Question number 42, sir. It is about potency, sir. Different practitioners find success with different potency. So what is the kind of action you and when do you consider increasing the potency of a remedy?
Potency problem is eternal problem. There are no guidelines. There are no specific rules. I know one practitioner, he is no more. He passed away when he was 102 years of age. Uttrev Krishnamurti. He was the first qualified doctor from Andhra Pradesh. He went all the way to Kolkata and studied there, DMS, and then started practice. He was the first practitioner. He had very good practice in Vijayawada, and he never prescribed any potency less than 1 ml. He never prescribed. He is a armamentarium, his books, his drugs, what is that, dispensing section does not have any medicine less than 1 ml. He used to get very brilliant results. So another honorary principal of Jeshuri Homeopathic College, I forgot his name, a Maharashtrian, an MBBS doctor practicing homeopathy. He never practiced, he never prescribed any medicine above 6C. He was also getting good results. He was also popular. He was a colleague of Jeshuria. That is why he was designated as honorary principal of Jeshuria Homeopathic College. So that is the beauty of homeopathic potency. A man who never prescribed any potency above 6 also was very successful. A man who never prescribed anything less than 1 ml was also successful. So ultimately, you are the judge of your own potency of prescription, and any prescription you give will definitely help you if it is suitable to the similar. If it is similar to the patient's symptomatology. It is not a problem. Potency is not a problem.
What is your take on homeopathy?
I don't know. Really, there is nothing like homeopathic aggravation. You find it only in organon of medicine. As a practitioner, I never found any homeopathic aggravation. Don't bother about it. Hmm? Okay, okay. Question అడుగుతారా? చెప్పు.
Your experience in treating avascular necrosis.
Hmm?
Your experience in
అదే మైపోతే
avascular necrosis of picture.
yeah, it's the acute one now. Nowadays, we get a lot of cases of vascular necrosis, and definitely our experience is very encouraging. Very good results we are getting, and the most importantly, chloric acid and Hecla leva. These two remedies are of great help in the treatment of avascular necrosis. A good number of cases have been treated with very good results. Lapisol, Asafoetida also antiseptic, acts on the bone, good remedy. Next question.
So your approach in treating or managing psychiatric disease.
Mostly, as general practitioners, mostly we get mentally disordered symptoms. Mentally disordered patients means mostly we get hysterical patients, women with some sort of a problem, mental problem, manifesting mental symptoms. And that is the common experience. Definitely, we have better remedies than the mainstream medicine because our medicines act mainly on the dynamic plane, mainly or only on the dynamic plane. Maybe if the potency is 3C or 6C, it may act on the lower plane. Otherwise, all our drugs act on dynamic plane. And all the psychosomatic or psychological problems, they are also manifested on the dynamic plane. Definitely, our drugs act much better. Our experience has been always very encouraging, very good in the treatment of psychological problems or psychosomatic problems. Even IBS, irritable bowel syndrome, is supposed to be psychosomatic problem. We do get a good number of cases, and quite encouraging results are there in our practice.
Last question, sir. Your experience in treating autism and ADHD.
ADHD, definitely we can do something good. Very, very encouraging. Autism, tough to treat. There are cases something I observed one very unusual thing in my practice. I do get a lot of children with autism, but many of them who are born in US, they are getting autism. I don't know what sort of Indians, our own people, Telugu people or Tamil people, our Indians settling in America, when they give birth to children, they are also becoming, many of them are becoming autistic. What sort of a relationship is there between autism and America? I don't know. Really, I don't know. Maybe some research scholars will be able to throw some light on that angle, on that disease. But homeopathy can do something. ADHD, yes, definitely we can help the child. And autism children also are amenable for homeopathic treatment. And homeopathy has got definitely a very, very positive and encouraging treatment even in the autism. Right?
One question.
Hmm.
What are the points to be concentrated while reading amenorrhea?
First of all, you decide whether it is physiological amenorrhea or pathological amenorrhea. And many of our friends, even when I was very young in the doing internship, also in those days also, they used to give pulsatilla as a sheet anchor of treatment for amenorrhea. No, pulsatilla never works if it is physiological amenorrhea. After all, pregnancy is not a disease. How can you give pulsatilla? You cannot abort a woman by giving pulsatilla if it is a physiological amenorrhea. How can you give? How can you expect the drug to act? Against the nature, pregnancy is natural. You can't abort it by giving a remedy. For that matter, no medicine can abort. So that is why I said first decide whether it is physiological amenorrhea or pathological amenorrhea. Pathological amenorrhea, yes, we have remedies. So many remedies depending upon the type of. What is the commonest cause for pathological amenorrhea? Commonest cause for pathological amenorrhea. Anemia. Anemia is the commonest cause, especially among Indian women. Very, very common. So address the anemia, not the patient for amenorrhea. Cure anemia and the woman gets a normal period. Or it may be off late. Most of the young women they are having with what we call ovarian cyst, PCOS, polycystic ovarian syndrome. Very, very common among young women. The majority of young women are coming with polycystic ovarian disease. And the research reveals the only reason for this is stress. Students, entrepreneurs, software women, they are who work under pressure. They are only suffering from PCOS. And definitely homeopathy is only the medicine which has got a very, very effective remedy in treating PCOS cases. Because hormonal treatment also may help some women, but hormones have got many other side effects, especially the girl starts putting on weight and no girl likes it. All of you know it. So definitely homeopathy is a better option in the treatment of PCOS also. That's okay.
Thank you so much, sir, for giving us this opportunity to have an interaction with you. India is a difficult country for us, and when it comes to homeopathy, there is no doubt that we are always need the distributor. And when you talk about homeopathy, it is on top of very special medicine in the world. There can be no better person than homeopathy. the reason why we had interaction. Thank you for the
Thank you, sir. Now I call upon the respected sponsor of today's event, Dr. G.R. sir, to come on to the dais for the concluding remarks. Welcome, sir, with a round of applause.
Meaning to one and all. My respect to my teacher, my guide, philosopher, Ramchander, Dr. Garu, President of this association, Dr. Gopal Krishna, General Secretary, Dr. Durga Prasad Rao, Treasurer, Dr. Venu, and other office bearers. On behalf of my family members, I thank this organization for giving this opportunity to pay my gratitude to my father through this organization. It is well organized. I am very lucky, sir. You have took nearly 2 hours time. You have answered nearly 50 questions. It is not an easy task. I think it is a great day for me. I also thank all the organizers for giving this opportunity. Thank you very much.
Thank you, sir. Now we move on to the next session, that is distribution of mementos. So for that, I call upon our sponsors of the event, Dr. G.R. Mohan sir and Dr. Padmaja Mohan ma'am, to please come on to the dais and join all the dignitaries on the dais to first felicitate the speaker of the session. Welcome all with a round of applause.
Then we also celebrate the meeting by
We request all the dignitaries on the dais to join for the felicitation ceremony of the chief speaker of the event, Dr. Shiva Shankar sir. Thank you, sir, for a elaborate session. Now we request all the dignitaries to felicitate President of HMAT, Dr. Gopal Krishna Garu. Now we request all the dignitaries to felicitate Dr. Venugopal Gauri Garu. Now we request the dignitaries to felicitate one of the panel member, Dr. Vivek Garu. Now we request the dignitaries to felicitate one more panelist, Dr. Venkat Raghav Garu. Please give a big round of applause. Now we request the dignitaries to felicitate Dr. Harshita Gure ma'am. Now we request all the dignitaries to felicitate the respected sponsor of the event, Dr. G.R. Mohan Garu. Thank you very much, sir, for sponsoring the event.